Hi everyone. So the terms of general somatic efferent, general visceral efferent, general visceral efferent, special visceral efferent, these are very confusing, and I was always very confused about it. So today we will discuss about it so that we can learn about it. So first we will start with the question. So a patient presents with loss of taste on the posterior one third of the tongue. Which functional fiber type is affected? GSA, GVA, SSA, SVA. Okay. Most people um, preparing for exams struggle to answer this confidently, but by the end of the video, you will be able to answer this question in seconds. Let's begin. So to start with, um, so uh, so there are in the cranial nerve fibers. There are fibers which are coming towards the brain, which are leaving the brain. So the efferent fibers which are arriving to the brain are the, and efferent which are exiting fibers are motor fibers which are leaving the CNS. So this is the first division, and then we will start with the efferent fibers. These are the important fibers. Efferent are the motor fibers that we know. So first of all is the G the and they are divided into general fibers and the special fibers. Okay. And the motor fibers supply the muscles, they supply the viscera, they supply the skeletal muscle, they supply the smooth muscle. So according to that they are divided. So first of them is the general somatic efferent. Somatic is related to the skeletal muscles. Yeah. And these are the voluntary muscles, and just imagine which are the skeletal muscles in the head and neck region. Okay. The that we come to our mind is the tongue muscles and the eye muscles. Okay. so 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 which nerves supply these muscles? The third, fourth, sixth for the eye movement, and 12th is for the tongue movement. So somatic, and these are the ordinary muscle, general, somatic, efferent. And next come is the viscera, smooth muscles, skeletal muscles we have learned, smooth muscles like a pupil constriction, and then supplying the viscera, and then supplying the glands, giving the parasympathetic supply to the glands, the lacrimation gland, to the salivary glands. So these are the visceral efferent. So these are general visceral efferent. So general visceral efferent, GVE, supplying the smooth and visceral glands. So now the question is, which nerves supply these? The gland salivary, we know that seventh and ninth nerve, and pupil reconstruction with the third nerve, and then also the some supply by the 10th nerve. Okay, parasympathetic supply. And next is the special visceral efferent. So we need to remember about it, that these are the why these some motor supply is special. So these fibers supply the skeletal muscle derived from the pharyngeal arches. We always consider pharyngeal arches as special. So for the first, so the pharyngeal arch is supplied by the which nerve? So we will reveal it. The supplied by the fifth by muscles of mastication, then muscles of facial expression by the second, by the seventh nerve, and then the pharynx and the larynx by the ninth and the 10th nerve. Okay. So what is here to remember is the special are the pharyngeal arches and the parasympathetic supply. Yeah, that these are the two things that we need to remember. Then we will come to the other thing is the we will start with the yeah. So the question is now, which category supplies the facial expression? GSE, GVE, SVE, we know facial expression, pharyngeal art, special motor. So these are the special visceral efferent. Now we will come to the efferent side, the sensory side. So these are divided into four divisions. So general, general somatic and general visceral, then special, special is also somatic and visceral. So we'll start with the general somatic efferent. Okay, so what is the function of the sensory nerve fibers? They take sensations. Okay, pain, touch, temperature from the head and neck region. Okay, so these are the general somatic efferent. Which nerve do it? Is the main part is the fifth nerve, and small part is by the seventh nerve and ninth and 10th nerve. Okay, main is the fifth nerve. Then is the sensation from the viscera. Okay, general visceral sensation. So general visceral sensations are the blood pressure, thoracic and abdominal viscera, and the carotid body and carotid sinus sensation, and these are taken by the ninth and the 10th nerve. Now comes the special sensations, special efferents. So two types, then divided into two parts, is the somatic and visceral. So that we need to remember what are the special somatic sensation and what are the special visceral sensation. The only important thing is that the visceral, they take sensation from the chemicals. Okay, first we will start with the somatic ones. Sensations, special sensations like vision, hearing and balance, these are the special somatic efferents. Okay, special somatic efferents. Vision, second nerve, hearing and balance are the eighth nerve. Okay, so special somatic efferents, SSA. Now special visceral efferent, what they are? As I told you, it's more related to from the viscera, and they are related to the chemicals. So olfaction is from the by the chemicals. Taste, anterior 1/3, 2/3, and then posterior 1/3, and some part of the 10th nerve. So these take taste and smell chemicals. That's why they are called special visceral efferents. Now let's go back to our question again from the beginning. So what was the question? Is patient present with loss of taste in the posterior 1/3 of the tongue. Which functional fiber type is affected? So we need to remember it is taste. Taste is a special sensation. Special sensory is afferent. Special. So the question is whether now this is, so we'll again start. This is taste is special. Now because taste is special sensation, whether this is related to chemicals or the general sensation, it is the visceral, because this is related to the chemical. So this is special visceral afferent by the ninth nerve, because it is related to the posterior 1/3. So every cranial nerve fibers in the brainstem belongs to one of these 7 functional components. Master these 7 and the rest of the cranial nerve anatomy becomes much easier. Okay, thank you.